Welcome to One Question with Uptop Health. And today our first question is, what are the first steps a healthcare provider can take to better emulate e-commerce? And Craig, can you start us off, please?
All right, what are the first steps they can take to emulate e-commerce? I think really understanding and believing that healthcare is becoming an experience industry, as more so than just a straight delivery industry. And what I mean by that is really looking at the patient and the member as a consumer, as an individual who is used to consumer experiences, expects those consumer experiences, and then seeing how you could deliver those experiences rather than focusing on productivity and efficiency and processing as your metrics. So really looking at your business and your industry from the light of the consumer or from the lens of the consumer, I think is the first step. And then once your team is bought into that belief, then really looking at what it is that those users are trying to accomplish and what the biggest friction points are. And oftentimes that's, if you think about it from your own experience, it's, hey, I have to get this procedure done, or I need to get checked on this. Is this provider within the network for my insurance? So it's really looking at the provider search. And then after that, it's really thinking about, okay, that provider's in the network. Are they good? What's the ratings and reviews? What's the social proof? And then from there, it's when are they available? How do I schedule an appointment? Things like that, and trying to reduce the friction and make it a more effortless experience in those areas, I think is a great first place to start. Mike, how about you?
Yeah, as you, Craig, were focusing on specific areas, I was trying to think of more philosophical ways in which an organization could approach it. And what I mean by that is, e-commerce, they operate very, I would say pretty lean, more lean probably than a healthcare organization. And in order for them to do that, their internal processes are a little bit more sharper, a little bit more efficient, a little bit more agile. And I think that a healthcare organization would need to kind of look inwards a bit philosophically and try to mimic, fine-tune their internal processes to be able to output, to the areas that you're talking about, to be able to fix and improve. I just feel like, that's probably where a lot of the issues arise, is internally. And so if that part is fine-tuned, if you will, like I said earlier, then they can focus on incremental improvements and specific areas of pain points, like you mentioned earlier. So that's probably what I would do.
Great, thanks, guys.